Hello, everyone. I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over a poster that was presented by my colleagues, Dr. Peter Anderson and Dr. Bill Davis. This was Dr. Peter Anderson was there at the conference in Philadelphia that took place last week. And so I'm presenting this for those that were not there or those that want to learn more about this. So, for starters, and that this was a scientific study of the conference was Scientific Study of Sexuality. So, for starters, cardiovascular disease continues to be the first leading cause of disease among worldwide. The primary cause of disease, which is causing 16% of the total deaths of the world. MI, heart attack, is a serious cardiovascular disease complication following viral infections. So herpes is a viral infection, and so this was HSV2. And so ages of 15 to 49 is mostly affected, and also males versus females and sexual minority are affected as well. Within the United States, nearly 20% of the population has this virus and causes HSV1 and HSV2. And that can potentially lead to cervical cancer, which makes it more serious for women than men. So what we explored here is when you have herpes and C-reactive protein, does that cause more heart attacks or not? And also, is herpes connected with heart attack to begin with? So in this visual, as you can see, the prevalence of high herpes is really the highest, most prevalent STI. And there's 1 million new herpes infections per year in the United States. And this is evident through the HSV having 560,000. So as you can see, we looked at the background, and multiracial populations had elevated rates of HSV than white population, making it a interesting, important social determinant of health. So genital herpes increases the risk of co-infection with other STIs, especially HIV. So not only herpes takes place primarily, but also when there's immunocompromised HIV, then this is more likely to occur. The way to prevent this is, of course, sometimes or always condoms, but also HIV. The way that pathophysiology works is that when the mucosal barriers are compromised, by HIV, STIs come in because of the lack of immune activation. So it's important to inform sexual partners if you have herpes, so that shared decision making can take place. A lot of times, sexual partners do not know that they have herpes. This is kind of a visual that shows the viral mechanism of erythrogenesis. So how does a virus affect the heart? And as you can see, alteration of cardiac ion channels, infection of vascular contributions, and direct invasion of the myocytes or heart cells. Heart muscle cells also causes that. So this was between 2001 and 2010, and then followed up through December 31, 2000. This was between 2001 and 2010, and the age group was greater than 20 years of age. And genital herpes was self-reported. If they said that they did, then they were considered positive. And if they had a heart attack, then that was important too. C-reactive protein, of course, was assessed through blood draw. And so what we were looking for is if there was a connection between HSV and myocardial infarction, and there was a connection. But also, we found that when people had both C-reactive protein and herpes, then they were more likely to have myocardial infarction than if they had each one of them alone. Um, looking at this, of course, inflammatory biomarkers by HSV, there was, um, let me move. There was a connection. Inflammatory biomarkers went up as HSV was positive. Also, prevalence of myocardial by HSV status. Myocardial infarction is on the y-axis and HSV status is on the x-axis. And so HSV positive, HSV1 positive, HSV2 positive, people had more likely an HSV2 positive to have myocardial infarction. So in the logistic regression that we ran, we found that, and this was a diverse cohort, that, as I said previously, elevated CRP patients with genital herpes were 4 times more likely to experience MI than those without elevated CRP. So condoms and dental dams are recommended during vaginal, anal, and oral sex. And so even after adjustment, this was significant. Of course, condoms don't necessarily guarantee this, but guarantee the lack of spread of herpes, but they significantly reduce transmission risk, and then avoid sex during outbreaks. Of course, limiting the number of sexual partners is important, and avoid sharing sex toys. This actually shows that inflammation has a very important connection, an important connection between infections in general and heart disease. So lower the amounts of infection means that your heart can stay, and a person can live longer and the heart can remain healthy. Here are the references down here, and I hope this has made some sense. Thank you for listening.